We have a very special guest for today's video. This is Alex.
Hi.
You may know her from the brand Educated Mess. If not, want to give a really quick intro.
I'm Alex. I'm a cosmetic chemist and I'm the co-founder of the brand Educated Mess. Yeah.
You guys had some really juicy questions that you wanted me to ask her about skincare, hair care, general beauty, so we're going to dive into all of that right now.
Let's do it.
All right, we're going to start off with some of the skincare questions that you guys sent in first. The first question is, does vitamin C really do anything?
It depends, I think. So I love vitamin C. Obviously, my brand has a vitamin C serum that's like our hero product. My qualm with vitamin C sometimes is its stability. There's so much data on vitamin C's ability to provide antioxidant protection, and sometimes it can help brighten up the skin and have some positive effects on collagen production. But it's like nearly impossible to work with. It is so unstable in the presence of water. It'll even break down in the presence of air. So you have to be careful with the packaging. But there are some really good technologies that have, come along over the years, or methods of stabilizing vitamin C. So there are some really effective products out there. And I think it can be great for, like I said, brightening and also helping boost collagen, but also providing that antioxidant protection so that your skin just looks healthier as you age.
Yeah, so it does do something if it's formulated
properly.
Yes.
Well,
okay.
and you know what? Honestly, let's be honest. Even those vitamin C serums that have started experiencing degradation and changing colors, they're still going to have, some effective vitamin C in them. In my opinion, I just hate knowing that my product is getting less effective as I'm using it. So that's why I'm like, but even those are going to do something.
Are there any ingredients that cancel each other out and should not be used together?
Oh my God, I've been waiting for you to ask me this one. No, so I think it is so funny because I worked as a formulation chemist for 5 years. I was in grad school for cosmetic science before then. I had never heard that you couldn't combine vitamin C with peptides. I had never heard that you couldn't combine vitamin C with retinol until I got onto TikTok. And I'm like, where did this come from, I think a lot of these ideas that are getting pushed, it's just a lot of a misunderstanding of science. So retinol and vitamin C, you technically maybe wouldn't go great together in a formula because they have different ranges of maximum pH stability. So if you're going to combine them in a formula, it's like, which one are we prioritizing here? But even then, like, there's so many vitamin C derivatives that are stable at the same pH as retinol that it's hard to say you can't combine these two in a formula either. Like, Storybook is a great vitamin C retinol product. But I think that somebody took that and ran with it and said you can't layer these together. You can layer them. It's totally fine. Vitamin C and peptides, most peptides are some of the most stable ingredients to work with. Like, I see that you can't mix matrixyl with vitamin C, and I'm like, matrixyl's pH stability is like 2 to 10. And like, you can mix that with anything. It's not nothing's gonna mess it up. Copper peptides can be a little tricky, and people say they'll cancel out with vitamin C. And I don't really think that's true either. So the problem there is that they're afraid that the copper is going to dissociate from the peptide and then bind to a site on the ascorbic acid molecule that's going to render both ineffective. But this doesn't really make sense for two reasons. First of all, there are studies that have shown that the copper doesn't really dissociate from the peptide above a pH of 4. So that's the reason I'm like, you can be hesitant, because most vitamin C with true ascorbic acid is mostly stable at like a pH of 3 to 4. So it makes sense that you wouldn't want to combine those in a formula. But again, that's in a formula,
Right.
So I do tell people, if you want to be safe, do your copper peptides at night, your vitamin C in the morning, if it's the true ascorbic acid, and neither of them are encapsulated. But it's just so complicated. I think that making these rules just makes everything so much more complicated for people for no reason. Like, the likelihood of an ingredient interaction of two products that you're layering is so much, it's like nothing,
Yeah.
There are two ingredients that I do recommend being a little careful with: hypochlorous acid and benzoyl peroxide. Both of these, the way they work, and the reason they're great for bacterial acne, they actually have a peroxide group on them that donates a free radical almost. So because of that, I do understand how some people say it could deactivate vitamin C or retinol, salicylic acid even. People say it's not a good combination. But I've talked to other chemists about this, and I'm like, what are your thoughts? And we all kind of have the general consensus of, if the hypochlorous acid is dried on your face, it's fine. You can go ahead and go with the rest of your routine. When it comes to benzoyl peroxide, I do recommend using it in a separate part of your routine than tretinoin or vitamin C. And by that I mean, like, if you're going to use it in the morning versus night. In my opinion, with the data that I have available to me right now, a rinse off benzoyl peroxide or hypochlorous acid is kind of like, as soon as your face is dry, it's fine. You can go in with the rest of your actives. The one I am like a little hesitant with is a benzoyl peroxide moisturizer or serum, because you're not sure exactly how much of it is absorbed or any of that. But with hypochlorous acid, I think it's fine as long as it's dry.
Amazing. That's so good to know, because I feel like there are a lot of things that people feel like they can't use together, and so therefore they have to then like pick one or the other.
Yes.
Yeah.
Or, like, oh, copper peptides and retinol, I can't use those. And it's like, yes, you can. Our skin naturally contains vitamin C and vitamin A. So if something was going to cancel vitamin C out, I make the case that, like, then that ingredient would never be beneficial in skincare at all, because then it would be interacting with the vitamin C in your skin and canceling it out. So by nature, it would actually make your skin look worse. You know what I mean?
Okay, so you basically can use everything together in theory, with the exception of hypochlorous acid if it's still wet, so wait for it to dry, and a leave-on benzoyl peroxide. So the alternative for that would be use a face wash, a rinse off, or alternate times
or just
of day.
do the gel and do it at a separate time of day than your retinoid or your acids. And that is my opinion, given the information I have available to me and given what I have read and discussed with other chemists. But of course, if something comes out that convinces me otherwise, but whenever I've gotten into conversations on the internet or in real life with people about this, we kind of all come to the same conclusion about that, you know? And it's I think a lot of these ingredients, it's totally fine. And it's a shame that people make it so complicated, because there are already so many products out there to pick from.
Yeah.
And then to be worried about, like, if I layer this in my routine, is it going to not be effective? If I mix it with this, is it not going to? Oh my God! I promise, like 99% of the time, it's totally fine. So I would just say, forget there's any rules at all. The likelihood of messing up is a lot lower than the likelihood of messing up.
Love it. that
did not make. Okay.
Yes, it did. Okay. I heard you mention encapsulation. That was one of the questions we got. What does it mean for something to be encapsulated, and why is that better?
Okay. So one of the hardest jobs for formulation chemists is actually getting something across skin's barrier. Even though a lot of people will tell you you absorb 60% of what you put on your skin, but have you ever showered? You don't swell up like a balloon. You know, our skin is designed to keep things out, you know? In our skin, we have these phospholipid bilayers, and so some delivery systems almost mimic the structure of the phospholipid bilayer to kind of help. The ingredient is inside of it, and it's almost like your skin recognizes it and it helps like kind of bring it in a little bit. I'm going to say that's not the technical way to explain it, but in basic terms, it's kind of like somebody trying to break into your house versus a delivery driver in his uniform. You're like, okay, you're supposed to be here. I can let you in.
Yeah.
Does that make sense?
Yeah. Maybe your analogies.
So certain types of encapsulation could make an ingredient better able to get across skin's barrier by being compatible with the phospholipid bilayer. There are certain like drug delivery mechanisms, but also encapsulation can be really beneficial for certain ingredients that are unstable in a formula, unstable in water, or unstable in the presence of air. If you have it encapsulated, then that active is going to remain intact until it reaches your skin and gets to the place where it needs to go. So when an ingredient does exist in an encapsulated version, you know, I don't expect every brand to use it, of course, because you know, it's going to be more expensive. But when I see a high-end brand using ingredients that could be encapsulated and they don't, and it's an ingredient that should be encapsulated, I get irritated because I'm like, you're charging a premium. Use the premium ingredients, you know? So I think that's why I talk about encapsulation so much on my page, because it can improve the efficacy, it can improve the benefits you're getting from a product, and if you're charging a premium, you should be doing it, in my opinion.
So what ingredients should we be looking for to be in an encapsulated form?
I love an encapsulated peptide. Certain peptides that I've seen have a really sophisticated delivery systems, and we use a couple of them. It's like a targeted delivery. They'll take the peptide that is active, right, and then they'll put it in a lactic acid, glycolic acid copolymer shell. It's a method they discovered from pharmaceutical research, I guess, according to the supplier, but you know. But then they'll actually tag the outside of that shell with another peptide, and that peptide is going to recognize an amino acid sequence on the site of activity, and they do it strategically based on whatever the site of activity is. So for melanocytes, it'll be a different amino acid sequence than if you're targeting like fibroblasts or collagen or something. But that essentially allows that peptide to act like a key that fits into the lock of the door. So all of the peptide that is active remains in that encapsulation until it gets where it needs to go, and then it releases, and all of it goes right there. So you're making sure that peptide's not just like floating around and like you're using a 10% with hopes that 1% will make it to where it needs to go. You're getting all of it there where it needs to go. So that's why I think, you know, with peptides, sometimes they do struggle to get across skin's barrier. So that's why I think delivery systems are so useful. But also because the technology's there, right? Another ingredient that I really think encapsulation is important is retinol. Retinol, though it is a very effective ingredient, it can be irritating, and there are certain delivery systems that have been designed to reduce the irritation potential and to deliver more of the retinol to the site of activity where it needs to go. And I just think you get the better bang for your buck. Like, I would prefer to spend a little more knowing that 100% of what I'm thinking is going into my skin is going to consistently get there, right? If the technology exists. If it doesn't exist yet, I can't be too picky, you know? Or if the product is like 10 to 20 bucks, I'm not going to be too picky. But then again, like, Naturium and Stratia, they use encapsulated delivery systems in their retinol products, and they're like 20 to 30 bucks. Geek and Gorgeous, retinol. I talk about that one all the time on my page. Yeah. They have sophisticated delivery systems, so yeah, I'm going to talk about those more than the higher end ones that don't. Like SkinCeuticals, retinol, you're charging almost $200 for that, and you're not even using a delivery system? It's crazy. That stuff could be breaking down in the formula. I'm sure they've done the research to show just how much is still there, but I'll save that rant for another time.
Okay, so peptides, retinol, anything else?
Yeah, like there's some, you know, there's actually a really cool delivery system I've recently seen, or that recently was introduced to me a couple years ago. It's like niacinamide, salicylic acid, and then it has like amylopectin and a different pectin in it, and it's kind of a gel. But the thing with that is that salicylic acid is great for acne, you know, it can help with oil control a little bit. And niacinamide is thought to help with oil control as well, but niacinamide will break down in an acidic pH. So you typically don't see those together in a stable formula, or if you do, it smells like nicotinic acid. Like it'll have that bitter, like if it has converted, or I don't even know if that's from the conversion, but I always notice that those two together give a weird smell. So this delivery system can actually it provides a vehicle for both salicylic and niacinamide to exist in the same formula at their optimal pHs. So there are delivery systems that can either help with penetration or help with the stability of formula. There are all different kinds of things you can do, but it's really cool, and I like seeing it in formulas.
Yeah, that's exciting.
That's exciting.
It is exciting, because then we're actually getting what we're paying for, hopefully. What are your thoughts on the debate versus chemical and physical sunscreen?
Well, there is a myth out there that physical sunscreen has a different mechanism of action for protecting skin than chemical sunscreen. One has to be absorbed into the bloodstream, you know, or they'll say that chemical sunscreens have to be absorbed before they're effective. They have to be activated. That's not true. They're all helping prevent UV rays from reaching your skin. And some people prefer mineral, some people prefer chemical. It's crazy that chemical sunscreens get demonized. And I was talking to Dr. Julian Sass about this recently, because people will say, okay, you can't use chemical sunscreens. Those are disrupting your hormones. You can only use mineral, but it can't be nano. So that leaves zinc oxide as the only approved filter in the US for UVA. And that leaves a major white cast on darker skin tones. So it's like a little bit inherently racist to be like the only excuse my language, sorry. So it's a little bit inherently racist to be like the only sunscreen that you should use. I'm gonna fearmonger everything else, but the only one that you're good with is the one that's gonna make you look like a ghost. Like, no, that's not cool. It's not cool when the data that proves that chemical sunscreens are bad doesn't exist. And do not get me started on the whole like reef safe thing. Oh God. Because people have decided that mineral sunscreen is safe for the reef, but chemical is not, because when they took a chemical filter at 100% and put it in a bag and suffocated the reef to where it wasn't getting any oxygen, water, or sunlight, the reef died. But guess what? The reef also died when they did the same thing with zinc oxide, but for some reason we cherry picked those studies. That's the thing with like all the fear mongering about ingredients that drives me up the wall, and I'm sure you too. I'm sure you see this with hair care. Anything that you put at an exaggerated concentration at some point is going to cause an adverse effect. Of course. So we need to like make sure that our methods, and I understand that sometimes you want to like exaggerate it to see if there's a potential there, but when we're talking about something like sunscreen that is preventing skin cancer, that's like a medical necessity for the population, and then you cherry pick these studies to make people feel guilty about the one aesthetically pleasing sunscreen that they've ever been able to find, it's kind of bullshit. In my opinion, excuse my language, it's kind of bullcrap. And what drives me crazy about the reef safe movement too is that if you really look into it, in Australia, one of the areas of the greatest impact on reefs right now is an area that humans don't even go. There's no sunscreen in the waters, but it is a shallow region. So in shallower regions, when humans do go there, there's a higher concentration of sun filters in the water, but it also heats up a lot quicker and is likely to experience the effects of global warming a lot more dramatically. Most scientists who I've talked to who have actually really done the digging on this all tend to have the same consensus that it's kind of likely that the temperature of the waters is affecting the reef safety a little bit more than the potential filters in waters. Because also let's remember that these filters that we're demonizing are not even water soluble. So, and environmentally, I know Jen, the Eco Well, has talked about this a lot on her page. People are always like, oh, zinc oxide, titanium are better for the environment. And she brought up a good point, which I didn't even know, about how harmful zinc oxide mining can be to the environment. So people always tend to look at the end result and they're like, oh, mineral sunscreens are good for the environment, chemical sunscreens are bad because they're chemical. There's so many sides to the story. Get a sunscreen you like. If it works for you, if it doesn't burn your eyes, if it doesn't leave a white cast on you, use it because any ingredients that are approved by the FDA have undergone extensive safety testing.
What makes products pill or ball up when you're applying them together, and how can you prevent that?
Okay, people always say it's dimethicone. I get that comment all the time, like, oh, I can't use this because it has dimethicone, so it pills. In my experience with products I've developed, the ones that pill, it tends to be a result of a polymer thickener, like in the water phase. Certain like polyacrylamide or cross polymers, sodium acrylates cross polymers sometimes. If you have too high of a level of that, even hyaluronic acid above 1%, I notice it starts to pill because you've got the powder that has been thickened up the water and it's absorbed into the water, but as the water evaporates, maybe when you're applying the product or the water disappears a little bit, you're left with a little more of that thickener. Something else that can happen though would be if you use like not an emulsion, which would be a mix of water and oil or water and silicone, but if it's like a straight silicone primer that you use, and then you use a water-based product over top of it, there could be an incompatibility with like that silicone is wanting to block the water. It's gonna the water's gonna ball up. You know, if you put like water on oil, it kind of like forms balls. If that water is thickened with a certain polymer thickener, and then it's not mixing with that silicone primer or something like that, I could see pilling there as well. But again, I think the culprits there are still very likely to be the polymer thickeners. So I don't really know there's so many to look for that I hate saying that because it's like, I wish it were just one ingredient that I could say, avoid this, but there are so many thickeners and blends, and at certain levels they're totally fine, and if you have 3 products with the same one, you might start to see it.
Sure.
You know?
So there's not like a clear-cut thing to be looking for in order to prevent that kind of just trial and error.
Yeah.
Which I feel like
that's how everything is.
Yes. And that I think like speaks to the experience I've had with skincare and testing different things. Sometimes all of a sudden things don't work when I'm layering them together, but then others do. Yeah.
And I always keep the thickeners in mind that I've had bad experiences with, and I'm like, I don't even keep them in the lab. I'm like, I don't even want to be tempted to use them. In my experience, it's kind of funny because the thickeners that tend to cause pilling most for me have always been the ones that you can post-add. Like, let's just say your batch messes up in production or something happens and it's thinner than it usually would be, you can add the thickener in at the end, because a lot of thickeners you can't do that with. You have to prehydrate them. So I think that if there's ever been a time where like I used to use this product and it never pilled on me and all of a sudden now it's pilling, it could be a combination of like whatever else you're using with it, or it could be that something happened with the batch during production and they had to add a little bit more than normal. And so maybe one batch comes out pilling a little more. It's interesting. When we were developing the products for Educated Mess, that was why with Sake Bomb that we did a reverse emulsion, because you thicken that with it's an interaction between salt and the emulsifier. You don't have to actually use a polymer thickener to get that nice texture. So I specifically was like, we need to do a moisturizer that will never pill no matter what you add to it. And so that's like why we did that with that one. But for the most part, most products are going to have a thickener in it that could cause pilling. Just find a combination that works for you and go with it.
Okay, so on my channel, I've obviously talked a lot about the unfair bad rap that ingredients like sulfates and silicones have gotten. Do you have any hunch as to why those ingredients have gotten such a bad reputation in the first place? Like where that started? Okay,
so I'm pretty sure with sulfates that literally a very big brand that I'm thinking of, almost did a campaign they had developed a shampoo that didn't have sulfates, and there was really like nothing special about it, so they just marketed it as sulfate free. But what the problem is with that is that then the consumer sees that and sees sulfate free, that must mean sulfates are bad if we're bragging about it. So then they're looking at, well, this other one I was using had sulfates, like, oh shoot, I can't use that, I gotta throw it away. And I think that's how a lot of it comes to be. Oh, an ingredient sounds bad, so a brand is like, oh, let's just tell people, like, we're not using it. Either it would never have been in the formula in the first place, or it's implying that the ingredient is bad when it's not. With silicones, I think a lot of the negativity comes from the fact that they're like not natural, which is crazy because like from an environmental standpoint, you're not really technically having to deplete any natural resources like with palm oil, you know? Silicones come from sand. I've also seen a lot of negativity about silicones in the press about being bad for the environment. Any like fugacity studies I've seen, the silicones are not building up in the environment. But it's so funny because people are always like, oh, natural. If it's not natural, it's not good. And I'm like, did you put dog crap on your face? That's natural. Natural is not always better.
No, it's not.
So,
and then it's like, then what are you using? Because then you can't use anything else that you're using.
Literally, and where do we draw the line of what's natural and what's not? Because like cetearyl alcohol technically comes from like coconut, I think, but it's been modified in the lab. I mean, that's not grown on the coconut tree. Like, it's weird. It's when I worked in formulation, I would have customers that were not okay with using xanthan gum, which is a natural food grade thickener, but because it had an X in the name, they thought their customers weren't going to want to see it. And so that was on their no-no list. And but they're all natural, but no xanthan gum. no hydroxymethylcellulose. I'm like, I don't really have many options that don't have an X in the name. Like, you're killing me, Smalls. You know, it's like, but what I do think is interesting about this conversation we're having is that I think in Europe, they're working on regulations to prevent brands from making silicone-free or sulfate-free claims if the ingredient they're claiming that they've left out has not been proven to be dangerous.
Wait, that's amazing.
Yeah, I remember a couple years ago that was in the works, and I haven't checked on it lately, but I hope that happens, and I hope it trickles down into our regulatory.
We need that.
We do. Because, I mean, it's just getting ridiculous at this point.
Yeah, and I think what you first said about sulfates and that being kind of like a marketing campaign to sell a product, I feel like that's what people don't realize and need to about so many of these claims is that they're coming from marketing, not from not from the chemist.
That was literally one of the biggest things that made me and Catherine start our own skincare line was that gap between the consumer and the chemist. So that is why I love TikTok. That's why Abby and I got to be such good friends. We talk in the same way. We deal with the same issues with hair care and skincare. It's like every day we open up TikTok and we see a new myth that we're like, where did that come from? And almost every time when you get to the root of the myth, it's marketing. It's the same as like people with nutrition, and they'll talk about like gut health and all this, and almost every single time at the very end of the video, they're selling you a fiber supplement. That's way overpriced. It's like, when we can't sell our product, we've got to make you feel really scared about something that was never an issue in the first place. So annoying. So I love that we both have our TikTok channels to help dispel some of these myths. That's why class like these are fun.
So to clarify, you approve of the use of sulfates and silicones in hair care products?
Definitely. Honestly, it's so funny because when I go to like buy a shampoo or conditioner from Target, if I don't know exactly what we get, I'll just like look at all the labels and be like, oh, is there a fun new conditioner I want to see? And one time I had a worker say like, oh, if you want a good silicone-free one, this brand over here. And I was like, I'm actually looking for the silicones. I'm not going to buy this conditioner if it doesn't have amodimethicone pretty high up on the label.
Yes.
But, you know, again, some hair types, amodimethicone might not work with some hair types. And I think people forget also that, you know, there's a little subjectivity as to what is going to be work for someone's hair.
Right.
And I'm sure you experience this a lot too, where like people will ask me very specific questions and I'm like, I wish it was that easy, but first of all, we're talking about science where there's an exception to every rule. And we're also talking about skin or hair where everyone's skin and hair is different. Do you see that a lot too?
I do. And I think it's just helpful to say that and realize that at the end of the day, there's usually not one solid answer for every single person. And so the best thing you can do is just try for yourself. See what works for you. And if it works well for you, then that's great. Keep using it.
That's great. Keep doing it.
And you don't have to be worried
like nothing we say either. If I say something is like not the best use of your money, and then you're like, but that's my favorite, use it. Do it. But I think it's also interesting because I tend to look for, when I'm like looking for advice from creators that maybe have an area of expertise different than mine. Like with you, I don't know much about the scalp. I know about products that are formulated for it, and I've got a lot to learn. But when I see a creator that's like, this is the one thing you should always look for, or the one ingredient to always avoid, or never do this, I'm like, you don't know what you're talking about, because there's always going to be an exception. So when we're giving advice and we're like, okay, it's you know, I know it's frustrating because I know people want to hear, they want it to be easy and clear cut. And so I feel bad giving advice like that. But I don't trust the advice that isn't like that, you know?
Right. Well, and that was a question that I actually got a lot for you. Like, are there any ingredients in particular that we should always avoid no matter what? And I knew what your answer was going to be, but I wanted to ask it because I think it's important to talk about. Like,
maybe straight formaldehyde, but even the formaldehyde releasers, there are issues with that whole category. There is nothing that I know of that is allowed in cosmetic products that is dangerous in a way that I would say avoid it altogether. I mean, I don't like phenol in the biologic research product, you know, the P50 that everyone likes. I don't personally love phenol, but not because I think it's dangerous, but it's because it irritates my skin. With most ingredients, if it's not irritating your skin and it's allowed in a cosmetic product, the company that released the ingredient in the first place probably did extensive toxicology studies in the first place. And when those get taken out of context, that's when the fear-mongering happens. And it's, you know, do you follow Ava Perkins?
I don't know if I do.
So she's a chemist. She's really young, so she just started posting.
Oh, nice.
I think she's getting her PhD in biomembrane sciences, but she's fast. She's so smart.
Oh, yeah, I did that last year.
But she was, right? Yeah, me casually. I just, like, collected that one. But she did a video talking about how interpreting scientific studies is a skill. And when you have a professional in the industry, like Abby and myself, and we're seeing somebody interpreting a study in a way that is so backwards, it's so frustrating. And so, again, that's why social media is great, because we can get on there and explain, like, okay, that looks bad the way that study was designed, but like, I promise these ingredients are a lot less stressful than you need to be worried about, you know? Social media is great because it allows us to spread more information about our respective fields, but then it's also tough because it waters it down with misinformation too.
This was a good segue into another question I had, which is, what do you think about these ingredient rating and reading apps like Yuka?
Oh my God, we can leave. No, I have done a couple of videos about Yuka. So what frustrates me so bad about Yuka is that they'll take an ingredient and they'll give it a specific yes, no, like 1, 2, 3, 4, bad. And then the whole product will get a bad rating. And then you go and click in and you're like, well, what is it that's so bad? And you click on the ingredient and it'll literally say, like, there's some that'll say, like, based on our opinion of, or the study that they're referencing, you click on it, and then you go to the bottom, and it's like, findings were inconclusive. And you're like, even though you're acknowledging that it was inconclusive, nobody is using your app that way. Most people, because you gave that clear-cut yes, no, good, bad, use it, don't use it, because you put it that way, that's how people are taking it. They're going to not say, well, let me go investigate. What was that one rating that had a bad rating? Oh, that was from an inhalation study, not a topical study. Oh, and that was at 30% rather than 1%, as the ingredient would be used topically, not inhaled also. People aren't looking at it that way because, again, interpreting scientific data is a skill, first of all, and routes of exposure are so important. So I cannot stand when an app is using studies and cherry-picking studies and ignoring the ones that say an ingredient is safe, only putting in the ones that say they're unsafe, to just drive this anxiety in consumers and make skincare way more complicated than it needs to be. Chemists are not putting ingredients in a product for no reason, first of all, and we're certainly not putting ingredients in there that are going to be dangerous. And most things have undergone extensive toxicology studies to make sure that they're totally safe. So those apps are stupid.
All right, I think that's all we have time for because we have a dinner reservation that we can't be late for.
And I'm mic'd up right now, and I'm pretty sure they heard my stomach growling. They had to have.
Well, thank you so much for answering all of these questions. I feel like this was so informative and like actually is going to help to just breathe some relief into people.
Yeah, I think in general, take it easy.
Yeah.
Don't worry about these ingredient combinations canceling out. But no, really, I think people make skincare and hair care way more complicated than it needs to be. Don't listen to apps that are demonizing every ingredient. When I say that, people are like, well, what can I download instead? I'm like,
nothing.
TikTok, and follow Abby, follow Javon, follow Michelle, follow all of us, you know? Follow experts you trust in the industry, but if something seems crazy or complicated, it's usually not. But thank you so much for having me on your channel, Abby, because this has been such a great, I love talking about this kind of stuff.
Yeah,
and
me too.
So really grateful that you're sharing your platform with us. And yeah.
All right, guys, leave comments in the below. If you have any other questions, comments, anything for Alex, leave them below, and I'll be chatting with you guys there as well.
Yeah.
Make sure to stay tuned for my next video, but until then, have a good one. Hey guys, welcome to... No, I haven't said this intro in so long.
Welcome to the channel.
I'm just kidding.
I could go on a rant about this.
Which ingredients... No, that's fine, go ahead.
Are you kidding me? I feel like that's a target. Like, that seems personal.
Yeah. Are there any ingredients that... Why did I say that like I was on a talk show? Oh my God.
Are there any ingredients?
Okay. Are there any ingredients that... Hold on. Okay.
There.
That was so perfect.
Thank you. And yeah. Where else was I going with that? I think people think so. Like, flick on the man. No, I'm just kidding. Don't put that in there. I've been waiting for this. Sorry, I'll quit talking.